you were talking in terms of ruling the unruly. How do we bring in the unstructured data fitting into the structured? Because a lot of what you called out is in a way unstructured data which may not be getting captured into the EMRs or EHRs. And how do we capitalize on that? What current challenges in EHRs related to unstructured data we can think of when we are looking at the broader context as well as the current EHRs concerns? What would be your opinion on that?
So AI as a whole has become very prevalent within healthcare. And one of the key areas is in documentation. We'll talk about that when we get to Simple FaceTime, but it is one of the key things that it's used for today. And that's being able to capture some of this unstructured data, put it into a medical, and then gleam it out with the machine learning, and even extending that into using natural language processing to be able to pull that data out. But that is just expanded in 10 years. The amount of data has tenfolded along with unstructured data, kind of what we saw when we even talked about AI use and how it's being done. And it's really because of that, things like that, healthy people and people and the organizations trying to improve our overall healthcare piece of it. But the key part from unstructured data, about 90% of the data today that's captured, up to 90%, is unstructured, depending on the level of sophistication that those groups are carrying and what their groups are doing. So even just trying to capture some of those dynamics of, just because you do an assessment, if it's a questionnaire, if that questionnaire is not incorporated into the medical record, it's not going to help you. So, and if you're changing EHRs, which many large groups are, and they're changing, is how do you convert all of that unstructured data that you have into your system to make sure you populate, and it's just not brought over as an image for the provider to view, because that's really the critical nature, is they need to have access to that information.